My name is Sarah Dooley, and I am a student at ACPI University. Today is August 20th, 2019, and I'm here to speak about delegation in nursing. Delegation is a complex skill that requires critical thinking, clinical judgment, and accountability for the care provided to patients. What is delegation? Delegation is the transfer of responsibility to perform a task from one person to another, while maintaining the accountability for the outcome of the patient. So to understand delegation, you have to be authoritative, accountable, and responsible. Authority refers to how you delegate a specific nursing skill, and you take that traditional role that's routinely performed and assign it to someone else, but maintaining the responsibility for the outcome. Learning how to delegate can be easy, especially if we understand the 5 rights of delegation. This is a tool that can be used to assist in making very effective decisions with delegation. These include the right task, the right circumstance, the right person, the right direction or communication, and the right supervision to perform the role that the delegator is passing to the delegatee. So then we need to ask ourselves, is this task okay to delegate? Is it the right task? Is it appropriate to delegate based off the individual's job description? Is it legally appropriate? Do the circumstances allow to pass this task onto that individual? Do we have the staffing to allow for that patient to take on more responsibilities? Is this person effective and willing to follow through with what you're asking of them? Is the delegation clear and the communication precise to know exactly what you're expecting of the patient and the person that you're delegating to, what you need to know outcome-wise, if there's any type of change or status change? Is this person able to bring that information back to the delegator to allow for frequent follow-up? And is supervision clear? So the delegator will continually monitor and evaluate the actions that are performed by the delegatee. I've also included this image and diagram from the National Council of State Boards of Nursing, also known as NCSBN. It's a delegation model that provides an organizational framework for delegation, and it identifies the roles and responsibilities for the employer, nurse leader, licensed nurse, and delegatee in the delegation process. So at the top in the teal, the employer nurse leader responsibilities, first is to identify themselves, to determine what their responsibilities are and what can be delegated and to whom, under what circumstances. Is there a policy or procedure to follow? Should we evaluate our process, and should we promote this culture or work environment of delegation? Then following down to the right in the pink, it has the delegatee responsibilities. That delegatee that's taking on the role, do they accept the activities based off of their own competency level? Do they maintain the competencies to continue doing those tasks for patients throughout their time at the workplace? And who maintains accountability for the delegated task? So then you go over to the orange, the licensed nurse responsibility. They determine the patient's needs and when to get to delegate based off of the delegatee's competencies. Then they have to, the RN licensed nurse has to ensure availability to delegate. So that's when we talk about staffing ratios and who evaluates the outcomes. So the nurse always maintains the responsibility and accountability to ensure safety and effective care is being provided to their assigned patients when delegated tasks are assigned to ancillary staff and their support staff. Finally, according to the Virginia Administrative Code criteria for delegation, delegation should be made within the judgment of the delegating nurse to ensure that the person performing the tasks does not jeopardize the health, safety, or welfare of the patient. The delegating nurse also retains the responsibility and accountability for all the nursing care of that patient, including the assessment, planning, evaluation, documentation, and supervision of the task being performed. The delegating nurse must be responsible and ensure that every procedure is done within the full scope of the delegated nurse's practice. Delegating tasks and procedures has to be communicated effectively. Instructions and performance of activities should be supervised. Potential complications and expected results should also be assessed and documented appropriately. The person who performs the nursing task that's been delegated is clearly identified in the documentation, and personal communication by the delegating nurse is always necessary. Direct communication is key to ensure the safety of the patient and that the task is documented and performed appropriately. Thank you for taking the time to listen to this PowerPoint regarding delegation in nursing. Please provide feedback and comments below in the section provided. To the right are the references used to produce this PowerPoint. Thank you.